Good afternoon and welcome to the pharmacy. My name is Zach. I am a pharmacist here. What's your name?
My name is Sarah Rowe.
Well, it's very nice to meet you, Sarah. Do you know why you are here today?
No, I do not.
Okay. Well, I called you back into my office because I wanted to give you a bit of medication counseling on a new prescription that was called in by your prescriber, Dr. Miller. Okay. Now, do you know what to expect from the medication that was just called in?
No, I do not.
You do not?
No.
So, do you know how your doctor told you to take the medication?
No.
Did your doctor let you know how what to expect from the medication?
No.
No. Okay. Well, that's perfectly fine because that's why I'm here. I'd like to just go over this medication with you take this time to go over everything with you, make sure that we are all on the same page as to how to take this.
Okay.
Now, before I get into the real nitty-gritty of talking about what's in this prescription, I do want to ask you a few preliminary questions. My first question is, can you tell me about the current medications that you're taking? Anything prescription-based,
No.
over-the-counter based?
No.
How about any herbal products that you might be on?
No.
You're not taking any of these? Okay. Can you tell me about any allergies that you might have?
I do not have any.
No known allergies at the moment?
No.
Okay, excellent. And we'll just move right on to the prescription itself.
Okay.
Okay, so the medication that Dr. Miller has prescribed to you is called furosemide. You might also hear it called Lasix. That's the name brand for it. Furosemide is the generic name. Dr. Miller would like you to take this medication at 20 milligram per tablet. She would like you to take one tablet by mouth every morning.
Okay.
And she gave you 3 refills on this medication with a quantity of 90. So each prescription refill is going to have a 3-month supply attached to it, including the initial fill. So this is a 1-year-long medication. Yep, so you'll have plenty to get you through the year. Now, this medication is usually prescribed to people for high blood pressure, hypertension, or edema. Edema is a type of disease where fluid might be building up in certain areas of your body, so it helps relieve some of that swelling that's built up. I wanted to talk to you about monitoring the hypertension because it sounds like you were put on this medication for high blood pressure specifically.
I guess so.
Yeah? So if you start the medication today, you might not feel your blood pressure lowering at first. The medication usually does take about 24 to 48 hours to activate. This will also be about the time frame for edema, that swelling, to start to go down. You'll see some improvement with that, hopefully within that time frame. It's very important that your doctor is able to monitor your blood pressure. And it wouldn't be a bad idea to have a blood pressure monitor of your own at home for you to constantly check and just make sure that things aren't getting too high. That sound good?
Yeah, sounds good.
Excellent. So, do you have a plan in place for where you're going to store the medication?
Oh, I was just going to store it in my bathroom cabinet.
Okay. Very important that the cabinet stays nice and dry. I wouldn't want it to get any excess moisture if you happen to take a shower in that bathroom or use any hot water. It's important that sunlight also doesn't hit that bottle, so keeping it in a nice, cool, stored place would be the most ideal spot. Okay? So it looks like the doctor wants you to take this medication in the morning.
I guess so.
Do you have a plan of what time, about when you would want to take this medicine?
I guess when I'm eating breakfast.
That's a great idea, yeah. I would definitely recommend making it a part of your daily routine, taking this medication as you get ready for the day, while you're eating your breakfast, anything that can help you remember. Now, I did want to tell you about those off days where you might miss a dosage. If you happen to forget to take your furosemide tablet in the morning, it's very important that you go ahead and take the medication as soon as you remember, okay? So if you take it at 10 a.m. every morning and it is even 10 o'clock at night, go ahead and take that tablet. Now, if it gets really close to the next time you're supposed to take it, so if you take it at 10 a.m. in the morning and it's 8 a.m. the next day, you forgot it yesterday, but it's almost time to take it again, I don't want you to double up on the medication. Don't take two. Don't worry about the one that you missed and that missed dose. Just go back to keeping that regular schedule of when you take that medication, okay? Excellent. Now, this medication may have some adverse side effects that I want you to be aware of. There are some minor side effects that you're likely to feel, which is increased urination. Again, this medication is designed to reduce all that swelling that's built up through the high blood pressure tension. So going to the bathroom at a more frequent pace would not be too far out of the realm of possibility of taking this medicine. Mm-hmm. And if you have an allergy to sulfonamides, this medication could cause an adverse reaction. All a sulfonamide is it's a type of drug that patients are administered for bacterial infections. It doesn't look like you're on any bacterial infection medication because, as we discussed, you're not really on anything at the moment, so there shouldn't be any issue with that. But I did want to make you aware in case you did get prescribed something for a bacterial infection. Okay? Some more adverse effects are excessive fluid loss, maybe some electrolyte loss. You might feel a bit drained, depleted, so making sure that you drink plenty of fluids, plenty of water is going to be pretty important with this medication. And if you happen to start taking any herbal products that might cause an adverse effect, you need to let either myself or your primary physician know. Okay? One last thing I wanted to go over with you is how to discard of the medication. The medication can be properly thrown away in a non-pleasurable way. If it is expired or outdated or no longer needed, non-pleasurable way, maybe with cat litter or with coffee grounds or something yucky that people don't really want to get their hands on. Okay? All right. I believe we've gone over everything that I wanted to go over with you. Now I'd like to ask you a few questions. Can you tell me how you're supposed to take this medication?
Yeah, I'm supposed to take it one tablet by mouth every morning.
Exactly. And are you going to try to keep it in a routine?
Yes.
Awesome. Can you tell me where the medication should be stored?
Away from the sunlight and moisture.
Exactly. Yep. And what is a possible side effect that could occur from taking this medication?
Swelling.
This medication is designed to reduce swelling. So the best way to reduce swelling is to drain it. I know. Is to drain it from your body. So excessive urination will probably be the most likely side effect that you feel from this medication.
Thank you, Dr.
Absolutely. Did you have any questions for me at the time?
No, I think you answered everything that I needed to ask.
Excellent. Well, if you do have any questions in the future, please feel free to reach out back to me or your primary physician. We'll be happy to help you.
Thank you.
Thank you. 8 minutes.